In many disciplines of medicine, questionnaires have long been used to assess and quantify patients' subjective complaints. Eye care is actually no exception. Eye care providers have used questionnaires to quantify subjective symptoms of dry eye disease for a number of years. Welcome to another edition of Dry Eye Coach. I'm Dr. Agustin Gonzalez, and like you, I'm a practicing clinician in Richardson, Texas. And today we're going to be talking about dry eye questionnaires. Questionnaires give both value and weight to what the patient's actually feeling, including symptoms and complaints of dry eye. These are extremely useful in quantifying if our treatment is efficient. Most times we can quantify staining and we can quantify osmolarity, but it is difficult to quantify symptoms affecting a patient's quality of life if these symptoms are not measured. The use of psychometrically sound questionnaires in our patient management provide a valid method to assess vital patient information. Now, to be valid, a questionnaire must possess certain qualities. It's got to be valid, reliable, accurate, consistent, and it's got to be sensitive to changes over time. These statistical metrics help validate if the questionnaire is useful. From the practicing clinician's point of view, dry eye disease questionnaires must be easy and quick to use. Otherwise, it's going to be taking our time. The DEQ, or dry eye questionnaire, and the contact lens DEQ, contact lens dry eye questionnaire, possess both categorical scales that measure the prevalence and severity of common symptoms. The OSDI is a very well-known questionnaire. The Ocular Surface Disease Index is a 12-question scale for patients that covers a broad spectrum of ocular surface symptoms. The subjective evaluation of symptoms of dryness questionnaire is a 3-item questionnaire that assesses the patient's perceived discomfort with respect to dryness. The SPEED questionnaire, the Standard Patient Evaluation of Eye Dryness questionnaire, is a new favorite, and it has demonstrated good validity and unidimensionality and objectivity when compared to other questionnaires. And this is it's a very quick questionnaire that can be adopted in office. Lastly, the impact of dry in everyday life, or the IDEAL questionnaire, is a lengthier questionnaire. It covers about 57 questions. It covers both dry eye disease symptoms and quality of life parameters, such as the impact of daily life and patient satisfaction with treatment. But in short, questionnaires help us quantify subjectively symptoms of dry eye disease. Questionnaires give clinicians another metric to measure and evaluate in guiding our success of therapy over time. And it's all guided by our patient's subjective symptoms, and something we can actually objectively measure. Thank you for taking the time to listen to this edition of Dry Eye Coach, and watch more for Dry Eye Coach videos discussing this and other subjects.